What if I am not around for things like the girls going from elementary to middle school? What if I'm not there for, when they're learning how to drive, or their proms or graduations, going to college?
I'm Elise.
I'm Greta.
I'm Scott.
I'm Amanda, and we're the Tysons.
We're a very active family, doing activities outdoors, exploring the cities. Both our girls are in swimming.
Amanda is somebody that is very upbeat, very kind, sweet person.
Just a few months shy of my 40th birthday, I was doing a self-exam. I'm pretty diligent about doing those, and I found a lump. Had a biopsy, and I remember the doctor saying, "I'm very concerned about this." I broke down when I was on the phone and they told me it was breast cancer.
It was devastating. Time kind of stopped. Where do we go from here? What are the next steps?
She did, unfortunately, get diagnosed up front with de novo metastatic or stage 4 breast cancer.
The statistics are pretty startling in terms of life expectancy after a stage 4 diagnosis. It's only about 18 to 36 months. I did chemo my first round for 12 weeks.
Those treatments kind of wiped her out.
Yeah, they were tough. We talked to the girls about what was gonna, happen, and we did actually do a family shave the head thing together. So it was a little bit less scary for them to see me without hair. After that, I moved on to oral medication.
For patients, being on an oral drug is amazing in terms of quality of life versus being on chemotherapy.
So far, that line of treatment for me has continued to work, and it's been over a year and a half now. I can continue to be a working mom.
Do most things like she did before now and still deal with her cancer thanks to the treatment that she's on. Whenever Amanda would have another PET scan come up, it's always kind of a little bit of a tense time. There's always this level of uncertainty.
I was in the office with Dr. Lassie, and we were looking at my latest PET scan. She said, "You're technically in remission." I was like, whoa, that's not a word that I thought I would hear when it comes to stage 4.
Amanda is doing great. Her PET CT shows no evidence of disease, which doesn't mean that your cancer is completely gone. It just means that there is no obvious cancer that we see. I'm hopeful that this will last a long time, but if it doesn't, we have a plan B and a plan C with all the great medications we have and the new drugs coming out.
From the beginning of this, she's taken it head on, and she hasn't given up. It's shown me how strong Amanda is.
We've had a big milestone recently with our youngest daughter starting kindergarten. Earlier this year, we took like a kind of our first big family vacation. We took our family to San Diego.
Being able to do that trip is something our whole family thinks about still to this day.
As we get further and further out from my initial diagnosis, I feel like those wins get bigger and bigger. I really appreciate the care that I've gotten, how responsive my team was, really put both of us at ease.
It was very inclusive of looking at our whole family and how to help all of us through this situation.
Dr. Lassie and the care team at mHealth Fairview Southdale really came out to bat for us.
I love Amanda, and after 15 years of doing this, you really get to know your patients. They kind of become part of your family. She is involved in a lot of fundraising events. She has increased awareness, so it's remarkable to see her attitude through all of this.
Research and money to help fund research is so important. People with metastatic breast cancer, they are living longer, and we want to continue to push for that.